This Sergeant Riggett. Hey, what's up? I'm on a call.
Get it hard and keep it up.
Actually, just shoot it to me in a text. I'll go check it as soon as I clear. All right, bye.
But when I was
How long does it take to go through the whole process?
Well, mine is 3 hours and 45 minutes.
You've been here for 3 hours?
Well, today, because I came late, so I've been on for 2 hours.
And how often you got to do that?
3 days a week. So I come Tuesday, Thursday, Saturday.
Dang, that's 9 hours out of your week.
It is, but you know what, sir? God is healing. I was just talking about that to the FA, so I'm not going to be on it alone.
Yeah.
And I have proof, like my number and my blood pressure. I haven't taken any medicine in about a month and a half, and so he's already started the healing.
Good.
I'm not going to be on this forever.
Good.
That's why I don't have a fistula or in my stomach, because I know the God we serve.
Awesome.
Yes, sir.
That's a good feeling.
Yes, sir.
Mom, my dad was fine. It was because I'm short, so I'm fat.
I can convince them if she agrees to just be fine and agreeable for the next 30 minutes, they'll go through it, they'll finish the treatment. They just won't put it back in. So it's easier to refuse her service, which is on fit.
Yeah, he's cool with
So
that.
they're fine.
Further
He
need,
wants to
copy.
stay.
They don't, I don't think he has to stay. They're fine with her finishing.
It occurred at 7308 127th Street. Calling parties in the lobby. You'll be contacting Marie
She's pretty
Sofer.
calm now.
She was sexually assaulted by a Billy Cadet on Saturday.
So
and
they're fine if you
physically
finish
assaulted
the
by a
treatment.
Crystal Miller.
Just,
Again, she's in the lobby.
I told them, be cordial with you. You be cordial with them. I see how you are.
Yes, sir. I'm really not bothered.
Okay.
And this is how I've been the whole time. And I mean it. So, thank
Yeah,
you.
I don't know where the misunderstanding comes from, but sometimes that happens.
Yes, sir, that's fine. I'm fine. I'm perfectly fine. But thank you, gentlemen.
Thank you.
Yes, sir.
Yeah, well, anybody. We're videoing you right now.
No, I'm just kidding. I was just wondering.
Yeah, anybody can do that anywhere, so anytime.
Even in a
So
like
we can
a
take
clinic
pictures
like
of her
this?
too.
No, we can't. That's
It's
HIPAA.
HIPAA.
Exactly.
I mean, it's HIPAA for them, too. They
I
can't
thought it
video
was
other
HIPAA for both
patients.
ways. But
HIPAA only applies to hospitals.
us, this clinic too.
Yeah, it affects us.
Dialysis.
Right.
So
Any
then
medical
technically
field.
she
I
So
mean,
she
yeah,
can't just video the
Because
clinic
there might
because
be
there's
other
other
patients in
patients in
there.
it. But she's trying to tell you she's not upset right now.
Right.
This was like 2 hours ago. We've been
Well,
trying
it's
to
been going on for 2
de-escalate this
hours.
whole time, and it's came to you guys.
Yeah.
Our
I'm
boss tried to go sit over there and explain her chair time to her like we have for the past year and a half.
Excuse me.
And she escalated it, started shouting. We called the big boss. She let us know that if
That's
she
her
gets
alarming.
louder, then to take her off.
Sorry.
And so then
Oh, that's fine.
we
You're fine.
tried to take her off, and she hit my hand away and said, "Don't touch me." And at that point, I was just like, okay. And then she started to calm down. But we've had two patients, those two patients in the corner, have mentioned 3 times to me today that she's disrupting them.
Okay.
And she's also not allowed to talk about another patient on the phone to somebody and in front of all the other. That is HIPAA.
Yeah.
And so that's why we're taking her off.
So we moved her to this
Excellent.
shift because she was on another shift where the patients felt unsafe. So this is the last straw.
Okay.
Hopefully.
So, like, she can finish today's treatment's my understanding, right? Is
Did
what
she agree to it?
Yeah, she agreed.
And then after that, you guys can just refuse any services you want. I mean, technically, you have the right to refuse.
We don't. It has to be go to the doctor, but
Well,
We just
on
need
our
to
side,
answer
on
your
our side, anybody has the right to refuse any business they don't want, especially if it's not a medical emergency. So if you guys wanted her to leave now, and you guys unhooked her, we could tell her to leave. But if she's willing to finish the treatment, you guys are willing to let her finish treatment today, just don't book her again. I mean, it sucks because she probably needs the treatment.
But
Exactly.
this is my question. She don't want either one of us to take her off. Who's going to take her off?
Right.
Well, one of us, me or I can hang out if you guys want until we
Okay.
get her unhooked
Reese
and
is on
gone.
her
But
way.
Because now she's not going to let any of us touch
yeah,
her.
she
That's
don't
how
wanna-
well,
she
she's gonna
enters.
have to.
Right.
She's gonna have to. She
But
can't.
that's she told us that if there's specific people here, she'll just leave.
Okay, well, I guess leave then.
And so then I'm like, okay, so
Unfortunately, she's affecting her own life at this point.
Right.
Yeah. I mean,
So she wants 30 minutes right now, but then if she comes in and sees people she don't like, she's just gonna leave. Do you see what it's just always something.
but we can't stop her from leaving. You know what I'm saying?
No, we want her to.
Yeah, I know. So like when
But
her
like
time's
right
out,
now,
But if you guys
How are you?
are willing to hang out,
is that for me?
Yeah. If
No,
I
the
was a
milkshake.
baby. Yeah.
oh,
I
you look so cute.
I don't feel cute. I wear a shirt.
oh, Mallory, that's your patient. There's a little baby butt.
Molly.
Can
So she's
touch it.
refusing to let us take her off at this point, so it'll probably be nothing more. And then
Can I
print out all the
charges?
stuff. And I was gonna let her hit me.
She did hit me in the hand. So I'm about to. Yep.
Do you think that we need them to stay, or do you think we
One of us is willing to say, I feel like I got a pretty good rapport with her right now.
Okay. I mean, it doesn't matter to me. I feel like
We're really busy, but we can hang out for a little. One of us can hang out for a little bit, and then when we get her out of here, then we just don't have to book her again.
Okay.
Don't let her come back.
Yeah. Well, this should be the end of it now if he's willing. And
But I don't know that I would explain that to her today.
No.
I would let her leave and then have somebody call her on the phone and be like, hey, listen, you're going to need to find a new venue. Because if she does it here, she's going to blow up in the lobby, and it's going to be a big mess and disturb other people. And
yeah, we
We
usually
just don't
call
know.
and then send a letter. Just tell her if she hit Mallory, and then that's terms for immediate
would you guys feel
discharge.
more comfortable if one of us stayed?
I mean, it doesn't.
It's no big deal.
I don't
She's
know
been in
how-
FA for a while, so she's my
I don't
strong
know
one.
how
I've
bad
been
she
this a little
was.
bit.
I mean, usually she's
What,
kind of stay
one
calm.
of us hang out. It's not a big deal. So,
Grab you a
Or we could call you.
well, the
I mean,
thing
then you
is,
have to
we're so busy. So once we go back in service, we're going to be going to the next thing. And
We don't have time for your little kid drama.
that's all we do
I
all
have a
day.
lot of phone calls, so if you guys want
We're not gonna let Marquita go talk to her.
Man, because check it. It's not because I'm here.
You want to clear? Or you want me to clear? Studdard wants somebody to go check an address for him. R. Mason, 7800 120. Oh, maybe not checking it. Maybe he wants a history on it. So
Either way, I can look it up and send it to him.
I don't know if you can call Studdard at 536-8208. I can't see that real well. Make sure that number's right.
Yeah, that's it.
And then just call Studdard with whatever you find.
Okay. Is that
I
his
appreciate it.
task force phone, I take it?
I guess. It wasn't, yeah, I don't know. Maybe.
I can do that.
Appreciate you. I'll just hang out here. I'll yell real loud if anything happens.
Things go south.
I'll say I'm 10:15 or 10:19, and then I'll drop the assist.
Since when? But I'm a silence and walk away.
Boy or girl?
A girl.
Boys are easier.
I know. I know.
My girl is a hot mess.
And they're cheaper too. Well, at least I'm like.
My boy's 17 and my girl's 14.
Oh, really?
And I do love her. But I would trade her. I would trade her in a heartbeat. It's like,
Yeah.
you know, just the emotional roller coaster and crying for. I'm like, what are you crying for? She's like, I don't know. And I'm like, okay, never mind. Just
That
stop.
age, no, you cannot. I'm not looking forward to that. My daughter's almost 10.
You got a daughter that's 10? Yeah.
And
So
a son
so you're getting ready.
almost
You're
6,
getting
yeah.
ready to be there.
Yeah.
So. Well, we'll hang out here and get it under control.
Okay, I appreciate it. Usually she'll stay pretty calm with me, but this patient,
Do you
not her.
think is her demeanor medical related? Like, is it like, you know, like some people like get violent with diabetes or like mood swings. And
I don't think it's that. I definitely
you probably
think
can't
it's like,
discuss that,
I think it's like definitely like mental health related, but she
Yeah.
doesn't have any diagnosis. But she also doesn't take any medication for diabetes. Like she doesn't take insulin. She doesn't take anything for her blood pressure. Like she just thinks she
I just
doesn't have anything wrong
curious
with
because when I
her.
came in, she's sweet as pie. Nice
She can turn it on and off for sure. Because
what
there's
is
been
it?
days that like she's cussed me out, and then the next day she wants to be like best friends, and I'm like, you are,
I know people like that.
yeah. Just, so, and at least if she's calm, like, let her stay, and then we don't have to worry about her anymore.
Yeah.
She's something.
So normally, like, this procedure would take like 3 hours. Oh wow,
3 to 4.
that's a long time.
Yeah, 3 days a week.
Wow.
It's a lot.
Unknowingly. It's my bat signal.
You're not going to touch
Oh,
me.
well, someone's gonna get off this machine.
You're not going to touch me. And I mean that.
Ma'am, she has to take you off the machine.
Sir, you already said that I could do it to 2:30, so what's the problem? I haven't said anything. I haven't said anything.
We just can't go against.
Y'all said I can say, so I don't understand the problem.
It's not up to us to say. The doctor said,
So what was the doctor called for after y'all said
I
just
don't
Then
know.
grab this.
don't
I have to take
don't
you off.
touch me.
Danielle, I have to take you
I
off.
said don't touch me, and I'm not playing. Don't touch me.
Hit her, Danielle.
Don't touch
I have to
me.
take you off.
EMS is on their way and they will take you off.
Okay.
I'm not playing. Y'all, if I said don't touch me, don't touch me. You ain't gonna make her touch me, and I said don't. You ain't gonna touch me.
I'm just gonna clank you.
Y'all are tripping.
No, but I need.
No, y'all are. If I said don't touch me, you're not gonna touch me.
ma'am, can I talk to you for a second? The
You
machine,
ain't gonna just come and
Okay,
try to touch me.
EMS is on their
I
way.
don't care.
EMS is not trained to take you off, so
Don't care. You're not gonna touch me.
I just have it paused.
What you think this is?
so how do we resolve this? If
At 2:30. Oh wait, I don't
the
understand
machine
why they
shut
were
off
called.
though?
That's fine.
Okay.
I'll wait till 2:30. I don't understand the big issue. If we already called y'all and it was settled, why were you called it in? Was I disturbing?
Well, here's the thing.
You were here, sir. Was I disturbing anybody?
No, not when I was
Exactly.
here. Not when I was here.
So the same way I was talking, and I was talking on the phone after you left. I've been talking like that all day. So, what's the issue? We already solved it. I'm not doing anything. I'm quiet. I'm calm. So why are you taking me off?
Oh, I'm not,
No, not you, sir. Why am I being taken off?
because
And then you
that's what their
make,
doctor told
and you
me.
think you gonna touch me, and I said don't. That's violating. I said don't. If I said don't touch me, you're not gonna touch me.
Okay.
So send whoever you have to. I'm fine with that. But if I say don't touch me, don't touch me, and you gonna just keep touching me, who do you think you are? Sir, I have a right to say, if I feel threatened, to say don't touch me.
But she
This
wasn't
is-
threatening you.
But this is, and I wasn't threatening them, so there we go.
So
Exactly.
that doesn't even make sense, man.
No, it does make sense.
They're trying to take you off an instrument.
Why?
Because they're refusing your service.
Why? You have
I
to
don't
have
know.
a you have to
No,
have
you
a reason
don't.
why. Yes, you do.
Any business.
Sir,
or what
this
has
is
the right to
different 'cause
refuse.
This is my health. I know my rights.
Okay.
I know my rights. I know them.
Okay, so you want to sit here till 2:30
That's
and then
fine. Yeah.
and
I'll
then
be-
EMS will unhook you and you
That's
can go.
fine. And then I'm gonna go home
Okay.
peacefully like I've been. But if I say don't touch me, don't. That's my right. And I said it calmly. And then you try to come over. I'm going to touch you. No, you're not.
I didn't say
said,
that.
Sir, not you. I'm talking about the situation.
Oh.
You're not going to touch me. You can't violate somebody's rights. And then you're going to tell me don't hit her? Don't touch me. You hear me saying don't touch me.
You don't have to get worked up. I'm right here. I'm
You
good.
hear me saying what? Don't touch me.
Okay.
How would you feel if somebody did that to you, sir? Would you be sitting here calm? I've
Well,
been
I wouldn't
sitting here
put myself
calm,
in that position.
but there's no reason why I'm in this because you've seen my demeanor.
Yeah, they're asking you to end your treatment and leave, and you're refusing to do so.
Because there's no reason, and I need my treatment. Like, you have no reason.
But they turned it off.
That's fine. Somebody else will touch me. They're not going to touch me.
Okay.
I don't understand how y'all take this stuff so lightly, sir. You've seen my demeanor, and I'm not saying you,
You mean I take it lightly?
not you.
I'm just trying to resolve the issue.
That's what I'm saying. Sir, this is serious. This is my life.
Right.
And so because I'm an advocate for my life,
No, I'm an advocate for your life too, and I want you to get the treatment, but you're just not working with them.
sir,
Go ahead.
I'm not going to comply with silliness.
Did they just call medics for that patient you guys
I'm
were
not
out there
going
with?
to do it.
Yeah, they did. She's refusing to let the nurses touch her, so we're going to have EMS unhook her.
Copy, I assume you seem secure then for them.
I couldn't copy you because of background noise.
Is the scene secure for them?
Yep, we'll be standing by waiting for them. It's secure.
Copy.
They're almost here.
Down their way.
Yeah, I really don't want you to get in there and get hurt.
I know. I know, but just the
436,
thing is, like, they're not
copy
trained
that.
to take her off. We could walk her through it. We could walk them through it if they're okay with it. But
They're pretty good dudes.
yeah,
439.
They'll help us out the best they can.
yeah. So I feel bad that everybody's having to get involved in this.
That's all right. We'll figure it out.
Sorry to be at 14214 South Haven. You'll be contacting Phil Stein. He said he had a trailer stolen, also a log splitter. I believe it's someone across the street, and it sounded like he was going to go over there and cause a disturbance. Told him to just wait until officers got there. 14214 South Sunland Highway. Correction, South Haven at 426.
I don't think I've ever been here.
Really? Usually it's pretty calm.
I've been here for 23 years. I don't think I've ever been in here.
Yeah. Usually, I mean, EMS is in here a lot, like the ambulances, but yeah, usually we don't really have like patient issues.
So what is it called, a stent? What's in a port?
Yeah, like we call it a dialysis catheter.
I'm sure they'll know. We'll see. Maybe you can educate them.
I mean, I'm sure I know they've been here, like they've seen it, but we usually all have them already off the machine and ready to go, but she's not getting her blood back or anything because it's going to be clotted because it's been alarming, so all we have to do is just flush the lumens, cap it, and wrap it up, and then she'll be good to go. I just don't know about after that. Like, if she's going to go home
Yeah.
pleasantly, hopefully.
She said she's going to sit there until 2:30 till her time's up, and then she's going to let them take it out and leave. So we got 6 minutes. So what's that machine do when it takes the blood?
It just filters the toxins and removes fluid.
It's amazing it can do that.
Yeah.
Is it your boss?
She's like a risk manager. So like,
Does she know you want to be a mermaid?
I want to be a mermaid. The police officer.
Is yours up there? What do you want to be?
no, I'm not here.
Oh, you're looking at that.
Oh.
Okay. So our wall.
Show me 215, Justin Germany with 2 Hill. At 1425.
Where are you putting the patients? Where are you putting the patients on there? Oh, they're the can. You know we have to. I haven't even started.
So if you're not here, where are you?
I'm at Blue Ridge in Raytown, off 63rd Street.
This used to be her clinic.
Yeah.
And you chose to move over there?
Yeah. Yeah.
I grew up over there.
Oh, you did? We've had to call the police over there. We have homeless people that hang out outside the clinic. So it's like right by Sherwin-Williams.
Yeah.
Right there. So.
And when they get in here, do you want me to explain to them that we just need them to assist us with returning it? So we're just gonna, once we return her, we just need her off the property.
Gentlemen. So we have a patient here that's kind of indifferent.
Okay.
She's kind of not really happy with the staff. She don't want to touch them. They've tried to disconnect her from the instrument so she can leave. She won't allow them to. She assaults them. She's agreed to let you guys disconnect it, but I don't know if you guys know how because it's...
No, you don't.
Police
We can't.
are actually talking
You
to
can't?
us.
We cannot.
Okay.
And the EMS is
Could you,
saying that they
you can't
cannot.
flush lumens or anything?
I mean, I can, but I can't touch your guys' devices.
Okay. We're not gonna, I mean, we won't, we're not giving her a
So
blood
we-
back. We're just flushing the lumens,
Just flush her
capping
lumens.
it, and then wrapping it with gauze. Like, that's it.
I mean, are you pulling out the lines and all that stuff, or what are you guys wanting?
No,
Who-
we just
who
need.
is it? Let me-
She's over here.
After you gentlemen.
Thanks, guys.
So all we have to do are just clamp these flush the limit with saline, which I have. And then tap it. Yeah, your tap, the gauze.
What's your first name? You want to go to the hospital?
I don't know why they thought that. They said they can go, but they're not gonna take me out there.
Take your time. What?
It's 2:30, and they're making a situation out of no situation.
Okay. So what?
I guess you're taking me out, and then I'll walk you through.
I have no problem with that, but will you allow them to do it?
I don't want them to touch me. They said, you know, because I feel threatened. I told her don't touch me because she came to me. But I have a right. If I said, don't touch me, don't touch me.
I understand that.
That's my right. And then you come in me and touch me, and then
Okay.
you say something after I said don't touch me,
Let me ask you this.
so I'm not gonna do it.
Who hooked you up to the monitor? Or who hooked
She's
you
not
up to the
here.
device? She's not here anymore? Okay. So what's the situation that happened that is throwing this up
Sir,
there?
here's the key situation. I don't understand why all this is happening. What happened is because she's not, because there was the write-up and the whole situation was on. And there was
Fletcher resident covers your front door.
the gist of
660113 Street at
and
Fletcher.
she didn't want to talk about it, but you're at FA, you're supposed to talk about situations. That's your job. And so she gets mad. I have it recorded. She gets mad and says I'm out. I even asked her.
3441 3441.
She said, no, you were not. So I had that. And so she goes and she calls people. They're going around asking people if I was disturbing. Nobody went to, I'll sit here watching everything. Nobody said I'm disturbing anybody because I'm not loud. But this is my right to talk on the phone about anything I want to. I can talk about what I want
So let me ask you this. Has your dialysis finished?
to. No. That's what I'm saying. It's 2:30.
Okay.
You can take me out
what
now.
time is she supposed to leave?
2:30.
At 2:30?
That's my ending time. And
So-
there's no reason for me to be taken off. You had no reason to stop my
So were you
treatment.
stopping her treatment in the middle of the process?
There's no
Trying to,
reason.
just because of the escalation of behavior, just policy and procedure, if people get escalated. And the physician.
What's the escalator? What's the escalator? That's what y'all are not presenting. What is the escalator? It's 2:30. Maybe I'm now. It's 2:30. I don't want to teach you. And they say you were like, they didn't show you.
Okay. I get, the thing is that this isn't my equipment, okay?
Okay, but
I
they
don't-
said they can walk you through. They the one, I don't know why they
Okay, so
called.
I don't have a doctor's order.
I don't know why they
I can't work
called.
off of their doctor. Okay, I have my own doctor protocols that I'm allowed to do certain things.
I don't know why they called. They told me that EFS, which I don't know why you would call, is going to take me out. And I don't understand it. She's not, because I asked her not to touch me. And you're going to keep on coming at me? I said don't touch me.
I understand that, okay? I get that 100%.
Okay.
Okay? But now, they're the ones that are in charge of these machines,
Okay.
okay? They're the ones that can take you off the machine.
So why did they tell me you were going to do it?
I don't know.
I don't either.
Okay.
I don't
The
understand
thing
either.
is that I have to call my medical director and ask him. He's not going to allow me to because it's a dialysis. Okay? Can you allow them to take it off?
She's not going to touch me.
It's not me, but anybody else in this room that can just flush your lumen, wrap you up in cabinet.
So why did you tell me you did it? I'm making this so sick.
Okay, that's,
No, it is not irrelevant. It's
No,
not
I
irrelevant.
never said this is irrelevant. Okay? I'm saying that that's not what we're doing right now. That if we can get somebody who works here to do it rather than her, is that okay?
Why did they call you, sir?
Because they call him, then they call us
He's
because
been
we're
here.
medical
Yeah.
providers.
He's been
That's
here.
why.
I know
Okay?
that.
They don't know all of the stuff that we can do out in the field, just like I don't know all the stuff that they can do out in here. Okay? They can do blood transfusions. I can't do blood transfusions. I can hang blood, but I can't do that stuff.
So I don't understand why
But they don't know that. Okay? So they call us, and then we inform them of what we can and can't do. Okay? And that's plain and simple. They just don't know some of the stuff. And that's okay. They can call us, and we can come in, we can inform them what we can and can't do, and then we go from there. Okay? So if there is somebody else here, or would you like me to contact my medical?
Let me grab my rig. Sorry to invite you to the show.
You're fine.
How are you?
Do you mind if she explains, the patient explains it, or we explain it to you and you explain it to her what we're doing when we take her off? He's been here the entire.
Don't ask me to take her. I'll run her into stuff one time.
Fourth Arcadian 13. Unfortunately,